Dr. Agnes, hello again.
Hello.
First of all, thank you so much for doing this. One of the chief objectives of the Forecasting Healthy Futures Global Summit is actually to collect the views of our really broad group of stakeholders and let them communicate those views, priorities, ideas to the COP30 team to influence the agenda for that year's climate change conference. So we had the privilege of hearing your remarks this morning, and so our participants learned a little bit about the plan for the Belém Health Action Plan. I want to compliment you again on the really inclusive, collaborative approach to developing it. I really appreciate that approach. And so this is consistent, this opportunity now, it's very consistent with that inclusive tone that you've set. So what we're going to do really is open Q&A. There's one microphone that's being passed around the room. So you're going to raise a hand if you have a question or a remark or a priority or a request of Dr. Agnes Soares de Silva, excuse me. I thought I would just start with one to get us started based on the last session on public-private partnerships, because I think it's something that Brazil has a really strong track record of doing between the Ministry of Health and private sector entities. One example is the Albert Einstein Hospital system, which I had the chance to visit recently. And I was really taken by the way that they are channeling any profits to augment public sector funds at hospitals in hard-to-reach communities throughout Brazil. I was struck by the comments just now about, from Gabrielle in particular, about Jacobs, some really specific things that sometimes make public-private partnership challenging. She mentioned a lot about sort of leadership changes and in continuity of planning, but she also talked about this issue of like visibility, long-term planning horizon, and the fact that when an opportunity to partner with the public sector is made available, companies aren't able to align their plans and assets and resources in advance. And so sometimes, if I understood Gabrielle correctly, it's like Jacobs is, maybe the opportunity is lost, a little bit of it, of what could come out of that partnership. So I wondered if you could just talk about, and in the context of COP30, the Ministry of Health too, a little bit, what do you see the role of the private sector, and what should companies like Jacobs do if they're interested in partnering more directly with the Ministry of Health or with the COP30 team?
Well, I think this is a gift, this type of question. I think particularly when we talk about climate change, I don't think we can leave anyone out of the discussion or the solution. So the private sector certainly needs to be engaged. Actually, the private sector also has losses in this context. But in terms of aligning priorities, I think it depends. With Brazil, I think it's clear when you talk about the health sector, because we have the SUS, Unified Health System, and actually the SUS is responsible for I think 85% of the population. So when we talk about what the private sector covers, it's 25%. And although it's very important, I think the private sector has a responsibility, the social responsibility. A great contribution could come from the private sector. And it's regarding innovation. Because sometimes things in the public sector, when you propose something, an innovation, it goes from a long way. When it really gets there, it's sustainable. But the private sector has sometimes a faster track to do and test and systematize the information and bring it back and share This is one way. And this is, I think, when we discussed all the tracks that we are working, when we talk about adaptation, there are, in each of them, you could think of something on improving early warning systems and conveying all the information, how to put them all together to have a better prediction of what is going to happen, but also to understand what's happening when it's the moment to make an intervention. So to engage into discussions like in places like today and during the whole process until we talk about COP30 as it was only the meeting there, but we are already doing it, so we are already preparing it. So I see a great opportunity, and it would be missing a chance of doing something really impactful, with a high impact, if we don't think on how we align priorities, how we look. So if we are looking for solutions for adaptation, where in the line of production this could fit in, and where in this process and these priorities. And if we talk about, I don't know, logistics or improving efficiency, energy efficiency, the services, I'm quite sure private sector will react to these things much faster than the public sector. So this is helpful to have this conversation and places where we can share experiences. And as I said, look at how we can combine and learn together in this big, what we call the mutirão, like I've mentioned. So everyone needs to be engaged to work.
Yeah, that's great. So more forums for public-private dialogue to identify those areas of need where the private sector can use their skills and absorb the risks sometimes of new product development, R&D, to solve those problems that can then be scaled through public sector. I like that idea. Do we have any questions out there? It's hard for us to see.
Oh, now it's much better. I can see you.
Yeah. Now it feels more like a discussion session. Raise your hand if you have a question. I think Grace has the microphone. Where's the microphone? Oh, up in front. And please introduce yourself as you ask the question. That would be great.
Okay, thank you for this opportunity. I'm Vital Ribeiro. I work in a national NGO, Health Hospitals Project. And I would like to hear from Agnes is about, we see the need of huge investment on adaptation, and Brazil is an important candidate on this. We have a lot of inequalities, and we need support on this. But my point is focusing on the health system, the SUS, how we could see this. People used to say that a crisis is always an opportunity. Not sure if you could use this for the climate crisis. Maybe it's too much crisis for opportunities, but also remember what Marina Silva said. We have this window of opportunity for transforming and for not making the same mistakes. The question is, how do you feel we could use part of the efforts on adaptation to make the public health system in Brazil more strong, more resilient? It's a little bit different of the previous question, because I'm focusing on this aspect of the investments on infrastructure or people or technology, all this together. And thank you.
Well, I think you gave me the answer in your question. So we need to do that. I don't think there is an option of not doing this. Actually, if we don't make a strong public health services system, I don't think we can be up to the challenge we have. So there is no way out. It's difficult, and I think we walked a long way already, but we know we are not there yet. Even when we look at the distribution of health services, the system is robust, and we can see that how we could recover, even with all the crises and COVID and all. And we have recovered the coverage for vaccines, at least in most part of the country. So I think we need to do that in order to be able to do. So adaptation is also increasing universal health coverage. There is no way to, go around this. So that's the reason when we talk about partnerships, it's like looking at the problem as a total. So we need to have strong public health systems. Otherwise, we won't have public health. And all the rest you can add and will be good. And normally that's also needed, but without this backbone, without this very strong system, we don't get everywhere, because even for the market, when you look, not everything is interesting. So the only reason you can reach out for the most vulnerable, it's because you are thinking in the public health. It's a total. So everyone is at risk when we don't do that, but it's not the logic of the market. So in a way, the public sector has to take care of the things that nobody has natural interest in doing it. And I believe public health is one of them. And so I think it's not, I wouldn't say it's an opportunity to do it, but it's the way climate change, what it does is put all our problems, they bring to the urgency of doing something about it. We cannot hide away or put, for too many years of efforts to get there. We need to do it all at once. So covering for what we have not done before, while we were doing more to remain doing what we have been doing up to now. So if we don't do that, it's not that we will not improve, it's that we will go back in the problem. So we will have increased mortality, infant mortality, we will start having problems to cover all the diseases we already had under control. So that's the type of problems I see we have to deal with when we are talking about climate change. So I remember the book, it was Naomi, I forgot her last name, but it was, this changes everything. So climate change changes everything. So we need to think differently. If we continue doing or working the way we are used to, we are not going to get to the protection of public health that we need to in this case. That's the way I see it. So, thank you.
That's great.
Thank you. James Colborn with the Clinton Health Access Initiative, and very happy to see the activities and the priorities laid out so far in the Health Action Plan. I think these documents and policies, along with vulnerability adaptation assessments and Health National Adaptation Plans, are vital to lay the foundation for building resilient health systems to climate change. But I'm wondering if you have identified priorities to operationalize some of these documents, if there are any examples that you're working to build towards for COP30 or beyond, that can show how we can move from plans and policies to actual action and results for some of these priorities.
Well, that's our challenge, I would say. So it's, I think I have used this example before. When we were discussing COVID, and we always forget it was not too long ago, we were doing and learning at the same time. And we were capable of doing it. And I think we were lucky enough to have a vaccine, otherwise we wouldn't be here discussing other things. But of course, there was a lot of work on that. And I think we can find the solutions for things if we put an effort on how we should, direct this. And there are many examples, and sometimes they are not even communicated as adaptation. But I would say one that helps in this process, and I think anyone who followed what happened with the floods in the south of Brazil, I think anyone really involved in any type of, event supporting or going there or reading the news, many of the solutions were found on the fly, having to do it, then it was done. And then they become like you incorporate the solutions in the planning. So if it happens again, we already know what needs to be done and we think before. Solutions like, of course, there were things that were prepared. The packages you send, like with the medication, that is the basics. When you lose medicines that are essential, quickly this could be delivered. But then they were noticing things that were not thought before, like how do you arrange that people who lost everything can get their medication that they had, all the files were lost. And how do you do when they go for security to another state and then they have to receive the medication? This was not in the plans, but nowadays, if it happens again, the solutions were already there. So many of the decrees and these things were thought and done very quickly. This is an example. So there are others, like the early warning systems. They require putting data together, and people are working on this. How do you do this efficiently, and that they are available when you need that, and that you can maintain it to sustain this as part of the system. So our surveillance systems, they are good. We were able to detect very early signs of, I don't know how many of you remember from Zika. It had happened elsewhere, but Brazil noticed what was happening in Zika and the effects. So this means we have a strong health surveillance system. How we improve that in a way to incorporate the, everything that we need on climate. So we noticed that we need better systems to inform what we need for the health sector. So general lines saying about the weather may not be sufficient to preview what is happening in a part of the city, but you already have that. So how do you do this more efficiently and not working separately? So we have CEMADEN and we have the health surveillance system, but they talk when there is a crisis. But now we have, for instance, this situation room that meets. Actually, they are meeting right now. I was looking in the telephone because I saw a sign that I should enter. So to follow up what's happening. So the climate change changes the way we need to work. So we cannot keep doing things the way you did before, otherwise we will never be ready to respond. And so I see much of this. And if you want to see what we're doing, we are right now, as I said, we have this, it's open for the consultation. Our national adaptation plan, the ADAPTA-SUS, is now up to April 25. It's open, everyone can look at it. and comment and give ideas. You know, it's Brazil has this. I think it's not only Brazil, but Brazil has a very strong process that must be open to public consultation. So it's also a way to see what we're planning, and maybe we missed important things that should be there, and that's the time to still can fit something. This is the national one, and then we are hoping, and that's what we are stimulating and we are working on, that every city should have their own plan to know of the details, that it's impossible to have all the solutions at a national level. So we need to go deep into the system to have it really build a resilient health system. So no way you can do alone, and there is no way that one solution fits all. So we need everyone to understand what they are doing. You cannot do it for others. Even the community has to be involved, otherwise it's impossible to find the best solutions. And we saw the examples. I think it's really interesting the way you show it. So people need to feel they are engaged and they are part of the solutions. They are not only the victims. So.
Yeah, no, that is great. You know, you bring up something so important as we try to learn and do at the same time, which we can. The opportunity of Brazil being the COP host this year, Brazil being a very large country with a really diverse set of residents and citizens impacted by climate change in a lot of different ways throughout the health system, having some recent acute experience, and you just talked on learning as you go with those. That's a marked difference maybe from previous COPs. So maybe this is an opportunity really for the domestic Brazil learning and experience to then be amplified through the COP30 mechanism and be part of that operationalization process that we just you were asked about. Are there other questions?
So I'm Chris Albuquerque from the Wellcome Trust. And first of all, I'd like to thank you for this amazing event, this incredible discussion. And my question has two parts. The first one concerns how the adaptation, the climate and health adaptation plan is being developed to account for the large variability in health system situations around the world. So I was privileged to attend the consultation meeting for the health adaptation plan, where there was a vast representation. There was a very big response to it. But still, it seems to be a large challenge to develop a recommendation that can engage leaders of countries where the health system, the health infrastructure varies all the way from a universal health system implemented to still a very sparse health system. So how can we propose a roadmap that would be able to engage leaders in this large variety of countries? The second part of the question is, in this meeting, one theme that arose very often was the importance of breaking silos. And when it concerns health, health resilience not only requires a robust health system that is adapted to climate change, but also everything else that will impact in health and in fact might decrease the demand on the health system. So the second part of the question is there any plan, or how are conversations with other ministries or other sectors of government proceeding so that perhaps these components that transcend the obligations of ministers of health can also be included in the action plan?
Wow, like a $1 million question. For the first part, I think it's a big challenge, and we saw that even in a small group that was this preliminary consultation meeting. You can see that, and we need to be smart, on the way to put things. Of course, we would like to say we don't need to discuss universal health care or universal health coverage because this is already being. It's past. Like we should only do it, not think about. But the problem is with climate change, if we don't have that, how are we going to respond to it? So I think, of course, we will not have all the solutions because this has to be worked out in a very situation. And I think we're very conscious that what we have in Brazil, and we have a lot of criticism on how things are organized and how we should improve things. But we also know the difference it is to have a system that is so big. So many countries don't have that, and maybe it's difficult for them to understand this is possible. And so it's a way that we are dealing with this legacy, as I said before. And I can tell you more than that. There are many countries inside Brazil. So when you look at the distribution, even the distribution of risks, and when we looked at like 6 biomes, so we need to think on different risks. And so each country will have to take this protagonism in itself. They have to understand their reality, or otherwise they cannot work on it. And if it is to start expanding the health services or to have a health systems to respond to it, be it because, and then measure how this will be, improve the survival and also, the well-being of the people. But you need to do it as a plan considering that there is climate change. So we cannot do it like from the 70s when we started primary health care, or in the 90s, and then it was, all we need to focus on the main burden of diseases, or so things that we did not solve the initial. And I think that could also be said. We still have even healthcare facilities in the world where not even water quality is assured, or electricity. So these are all legacies that unfortunately we human beings have not solved. We are not everything is blamed to climate change, but climate change makes it worse, more difficult. We didn't do it with before with Millennium Development Goals, and we are not doing with the Sustainable Development Goals. We are not going to do with the climate change if we don't give visibility what this has to do with health and how we need to solve these problems once at all. Put a price on it, how much it costs to all of us. And I think this is part of the work that needs to be done. And I forgot the second part. The question on, if you can say.
I forgot the second part of the question as well.
Oh, the intersectoral.
Right.
Yeah, that's
very core to
yeah,
our...
of course. So I think for the health sector, we need first to answer, what do I need to tell my Ministry of Health to do? So that's the question we need to answer when we talk in the health sector. And we can go around it, but in the end it is what they need to do and can do without having to talk to others, and they can be a voice when, you sit there with the Ministry of Finance and say, no, I need this because I need to deliver this. This is the part that's only health sector. The other is, I'm the minister, I said, listen, if you are going to do something about it, please do first the ones that have the best effect from me. So if it is air pollution, or the energy matrix needs to change, so nobody using fossil fuels, or nobody using wood to cook, like great part of the world is still uses it. So these are the things that the health sector needs to tell others how to better use the money. So the best will have, release pressure to the health systems, release costs to healthcare, and we'll have a better solution for everyone. So basically, there are two big tasks, but we need to be clear what is really that the health ministers have to do, and what they need to know to talk to others and convince others of doing, what's best for everyone. That's, I believe, it would be the way to go. If we can do that in a plan, perfect. And in Brazil, we were doing these discussions, but I think it requires a longer time, and I think the time is up.
Time is up.
But we need to have this conversation. And I think this is part of the learning process.
That goes back to so many things we touched on today in terms of thinking of health as the outcome by which we're measuring the efficacy of adaptation and mitigation efforts in other sectors. And so the closer, the more progress we can make in harmonizing indicators and agreeing on what those outcomes look like, the easier it'll be for the health minister to go speak to somebody in a health determinant sector and to have their incentives and goals already aligned because they're working toward the same outcome. And I think that's kind of the foundation of a lot of our conversations today. So I'm glad we ended on that note. And I'll just take the opportunity to thank you again, Dr. Agnes, and let you know that we package all of the conversations that we've had over the course of these few days and want to make that available to you. And our reminder to our summit participants that we also include a perspectives section, and you're welcome to submit those thoughts and comments and priorities for the COP30 team that we can add to that collection. And thank you once again for your willingness to be open and dialogue, and good luck with the work ahead.
Good luck to all of us.
Yeah.
So thank you.